Hello and welcome to Fighting COVID with me, Antra Bose. As you all know, the national immunization campaign for those with the second dose kicked off successfully in the Sultanate about 2 weeks ago, and the Ministry of Health is still continuing it. There was a lot of confusion initially about whether it is for those who need a first shot as well, but the relevant authorities have clarified that as of now, it is only due for those who have already taken the shot 10 weeks ago or so. Having said that, the first dose has rolled out for those working in the government sectors. For instance, Oman airports launched a vaccination campaign on June 9th for the staff of Oman airports ground handling and cargo. Moreover, the Royal Oman Police is continuing to implement the vaccination campaign against COVID-19 for all its employees. As part of the national campaign to receive the vaccine against the emerging COVID-19, the Royal Oman Police, in cooperation with the Ministry of Health, vaccinated its employees with the first dose of the vaccine in the governorates of Al Buremi, Musandam, South Al Batana, South Al Sharqiya and North Al Sharqiya, while medical teams continue to vaccinate police employees in the rest of the Sultanate's governorates according to the field plan for immunization that was approved by the General Police Command. This was according to a statement by the Royal Oman Police. Unfortunately, despite the rollout of the vaccines and the national immunization campaign against COVID, Oman is seeing an increase in the number of COVID cases. In fact, on June 9th, and according to an official from the Ministry of Health, for the first time in Oman, the total number of COVID-19 inpatients at hospitals exceeded 1,000. On June 9, 2021, the Ministry of Health announced the registration of 1,931 new COVID-19 cases, which is 3.35 times higher than the 576 cases reported on May 11th. Dr. Farial Al-Lawati, a senior consultant in infectious diseases at the Royal Hospital, said she had witnessed an unprecedented increase in infection numbers during the current wave when compared to the previous ones. According to her, the indicators of this wave are very worrisome, and this recent spike in numbers is because of gatherings that took place during Eid. In addition to that, on June 10th, Oman recorded a new high for hospitalized patients with more than 160 cases of COVID-19 and 19 recorded deaths, the highest number since April as per the data from the Ministry of Health. This points to a significant increase in new cases of coronavirus infections and ICU patients in the region. Speaking exclusively to Times of Oman, Ibrahim Al-Maimani, a social activist and data analyst, said that the total number of infections in the month of June reached 13,000 with an average of 1,300 infections per day. He said that we are on the verge of breaking the record for the month of July 2020, where 39,000 infections were recorded with an average of 1,303 new infections per day. Based on the current statistics and readings of the epidemiological situation in June, he expects the increase in new cases to reach more than 2,000 and the continuation of recording large numbers of daily deaths to exceed 20 deaths during the next week. In the end, he said that there is a need to continue taking precautionary measures even if the vaccine is taken, and the urgent need to take the vaccine for those who have the opportunity. Just like what Al-Maimani said, the concerned authorities have been extremely vocal about getting vaccine jabs, especially for those who fall into the target groups, so that the country's aim to reach 70% of vaccinated population could be easily attained and the risk of the spread of the infection could be reduced. The Ministry of Health has issued a statement last week on Thursday that people with epilepsy can take the COVID-19 vaccine if they are among the target groups, and before that it was also announced that lactating mothers and those women who plan to conceive can also get the vaccine shots. Recently, the ministry has also announced about the availability of vaccine shots of AstraZeneca at private hospitals for those wishing to travel abroad or not willing to wait for their number according to the priority list. The ministry said that it will cost 22 Omani riyals for 2 doses of the vaccine against COVID-19 at private hospitals in the Sultanate. Those were the local COVID-19 updates. We'll take a short commercial break and we'll be back.
Oman's largest online supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
Welcome back to Fighting COVID with me, Antra Bose. Now, a common question we often get asked is how long do COVID-19 vaccines take to start working? According to a report published on AAP by James Ross, clinical trials show COVID-19 vaccine protection is optimal from about 2 weeks after your second dose. This means they nearly completely protect against severe disease and death in healthy people, dramatically reduce the likelihood of symptoms with COVID-19, reduce the likelihood of infection with the virus, and if you do get infected, they reduce the amount of virus you make. Emerging evidence suggests this reduces the likelihood you will pass the virus to other people. Each dose of a vaccine essentially shifts the odds in your favor. 1 dose gives you a lower chance of reaping some of these benefits, while 2 doses gives you a much higher likelihood of these benefits. Though even with the 2 doses, you could still be unlucky and get infected, develop disease, or pass on the virus like what is happening in India. A preliminary study conducted by the All India Institute of Medical Science, Delhi, claimed that the presence of COVID-19 Delta variant is predominantly found even after getting a single dose or both doses of COVID-19 vaccine. The study included 63 people who got breakthrough infections, of which 36 patients received 2 doses, while 27 had received only 1 dose of the vaccine. SARS-CoV-2 lineages could be assigned for a total of 36 or 57.1% samples, 19 or 52.8% in patients who completed both doses, and 17 or 47.2% in patients who completed only a single dose. B.1.617.2 was found to be the predominant lineage with 23 samples or 63.9%, out of which 12 were fully vaccinated and 11 in partially vaccinated groups. 4 or 11.1% and 1 or 2.8% samples were assigned the lineage B.1.617.1 and B.1.1.7 respectively. The B.1.617.2 lineage was first described in India and associated with increased transmissibility as well as immune escape. The B.1.617.2 lineage was first described in India and associated with increased transmissibility as well as immune escape, and has grown to become one of the predominant lineages in India. The report further stated that there are no reports of deaths in a sample size of 63 people, even though almost all cases reported high-grade unremitting fever for 5 to 7 days. The presence of Delta variant was about 60% of people who received a double dose of either vaccine, and it was found in 77% of people who received the dose. That brings us to the end of our Fighting COVID episode. We'll be back next week with more updates, so stay tuned and keep watching TTV.